Okay, so I want to welcome all the viewers to Ethics and Technology in 2021. This is being recorded. There's no one live participating at the moment, so it's just me doing a recording that could affect things a little bit in how I approach talking about things. I'm not going to ask people to raise their hands, obviously, and so forth. I don't know, some of you may have seen sort of an hour and a half presentation during the symposium. I've got to tell you a little bit about that. That had to do with me presenting a model for navigating ethical and legal and other kinds of problems called the multiple perspective model. So I probably will mention that today in this presentation. So if you haven't already seen that, it would go hand in hand with this. It's not essential. This information in the next hour and a half will stand alone, but it might make more sense or be best if you do view that other hour and a half presentation. So we're going to get into this pretty quickly because we have a lot of material to cover, not that much time. I'm also going to make the assumption that viewers have access to a probably a PDF copy of the slides that I'll be sharing, because some of the slides I'm just going to point to and skip over and say you can look at that later if you need to, or if that fits your situation. So with all that in mind, very quickly, I want to tell you just enough about myself so you'll know who the speaker is, and always a good thing, right? So I'm Terry Casey. I'm a licensed psychologist. I'm in private practice here in Franklin, Tennessee, just south of Nashville. The major things that I would want to convey to you, that number one, I've worked in a lot of different settings over the years, going back as far as in 1981. I've worked inpatient, hospital, outpatient, residential treatment, educational settings, private practice, obviously, worked a little bit in correctional settings, and there's probably a few other things along the way. What I do now in my private practice, I do see clients for therapy. I do a fair amount of consulting that tends to be with private practices, counseling or mental health organizations, sometimes educational institutions, and occasionally with churches or businesses about organizational or staffing kinds of issues. So the centerpiece, I guess you'd say, of my professional experience, I was the director of counseling and psychological services at a pretty good sized nonprofit called Agape here based in Nashville. So the counseling and psychological services side of that nonprofit, I'll give you some numbers here. We had, I was there for 20 years. And during that time, most years we had around 30, 32 or so therapists of all different license types. We also had interns and practicum students. We had psychiatrists, nurse practitioners. So the full range of mental health providers. We had, I think, 20 some odd offices scattered around Middle Tennessee. And we averaged somewhere between 11 and 1,200, sometimes higher, therapy sessions agency-wide per month. So I say all that to say this: when I started in that particular position, I had to become familiar with licensing rules, primarily those for psychology licenses, social work, marriage, family therapy, and professional counseling, as well as their corresponding codes of ethics. I also had to do some administrative things. Anyway, so I had to do a lot of different kinds of things and be knowledgeable about those areas. Well, that resulted in me having been given the opportunity to teach in Lipscomb University, their CACREP accredited clinical mental health counseling program. And so I've been teaching their ethics and professional issues course there since this is, I think it's going to be year 15 coming up. All right, so that's the backdrop. I was also the ethics chair for a state level professional organization for, I think, 5 years. Enough about that. So let's go ahead and jump right in. So again, some of these introductory slides, you can read it for yourself. I know, typically ethics trainings, unfortunately, I think people assume they're going to be boring or tedious. I hope that won't happen. I am going to be moving quickly. I do want to emphasize this on slide 4. I really feel like it's best to have, first of all, to have an effective process of navigating. This goes back to that multiple perspective model I mentioned. It's in the other presentation. So I'm always thinking about the process, having a process, having it so that it's second nature, so you can think on your feet using that process. The second thing I want to emphasize here are that laws, licensing rules, and codes of ethics vary significantly from one state to another, and they even vary from one license type to another within the same state. Many of you are aware of that, but I really don't want to make assumptions that people are. I'm assuming there's a pretty wide range, experience-wise, of mental health practitioners who will be viewing this, and of multiple license types. Here are the learning objectives. You know how those work. We will meet those during our next hour and a half. A little disclaimer here. I'm not an attorney. We are going to be talking about some legal issues because you have to. As I'll explain in a minute, ethics and legal and even clinical and policy, all of these different kinds of issues, they're not isolated. They don't occur in a vacuum, but more about that in a minute. So I'm not an attorney. I'm not trying to give you legal advice. That's not the intention here, but I do want to discuss some things to get you thinking about some things and have some awareness of some things. Legal situations are highly individualized. Of course, you may need to seek an attorney, a qualified attorney, sure. These things vary from state to state, as I said before. Now, so where we're going to start are codes of ethics and technology issues, the intersection of those two things. So when I'm talking about codes of ethics, here's what I will be thinking about and what I want you to understand. I'm going to be talking about the codes of ethics for those license types I mentioned a couple of moments ago, specifically in Tennessee. And in Tennessee, as I'm sure you're all aware, if you're one of those license types, then you are required by your licensing rules to follow a particular national professional organization's code of ethics. So for me, I'm a psychologist. Tennessee rules for my license require me to follow the APA code of ethics, and counselors, the ACA, and so forth. Social workers, NASW, that's just in this state. It's not that way in every state, not by a long shot. So here, with this intersection of national professional organizations and technology issues, if you were to look in the codes of ethics, but not just the codes of ethics, if you were to look to these national professional organizations, here are some ways they have addressed technology issues. Number one, they've made some changes to the organization's code of ethics, additions to, say, maybe fundamental principles in the preamble, or specific new technology-related standards. A good example of that is in 2014, the ACA Code of Ethics added an entire chapter about technology, social media, and distance counseling. So that came out in 2014. So they developed the wording for that new chapter in 2012 and 2013. So it's been a while, but they actually did a pretty good job. How would you like to have to think ahead about how things are going to be technology-wise, even 5 years down the road, much less say 10? So that's one way. These organizations have made changes or additions to their codes of ethics. Remember, these codes of ethics are developed by and for the membership of these organizations. The licensing boards have simply reached over and borrowed these and plugged them in, requiring people like me and probably most of you, requiring you to follow them. But it's two different kinds of organizations, a national professional organization and a licensing board. More about that in a minute. So the other thing these organizations have done is that they've developed, in some cases, specific technology, down here. They have established separate sets of technology-related guidelines. There's a couple that I'll mention a few times throughout the next hour and a half. The APA back in 2013 established a set of guidelines for psychologists, well, specifically APA members, but they're guidelines. They're not in the code of ethics. So there's a difference there. So you don't have to follow them, but they're good, relevant guidelines. Also, the NVCC has developed something similar. I'll point to that a little more specifically later. All right, so with that in mind, those are the two ways that national professional organizations have done things that directly affect or resources that are provided for you and me as clinicians. So I'm not going to, some of these recordings I will play. This is what I think sums up a lot of thinking and will get us together on the same page. This happens to be from the ACA. By the way, there are similar, there are similar statements that we could take from other codes of ethics like the AAMFT on the next slide. But let's listen to this one from the APA. Take about 30 seconds, I think. Here we go. You may have to turn the volume up on your device. But
in 2014, the ACA devoted an entire new major section H, distance counseling, technology, and social media, stating, counselors understand that the profession of counseling may no longer be limited to in-person, face-to-face interactions. Counselors actively attempt to understand the evolving nature of the profession with regard to distance counseling, technology, and social media, and how such resources may be used to better serve their clients. Counselors strive to become knowledgeable about these resources. Counselors understand additional concerns related to the use of distance counseling, technology, and social media, and make every attempt to protect confidentiality and meet any legal and ethical requirements for the use of such resources.
Okay, so if you're a professional counselor licensed in Tennessee, probably an LPC MHSP rather than the regular non-MHSP. So when I say counselor, I'm meaning LPC MHSP. So if you're an LPC MHSP in Tennessee, you have to abide by this because you're required to follow the ACA Code of Ethics. But I want to point out, look what it says in the last sentence. It mentions not just ethical, but legal. Look for the wording about legal in your codes of ethics. It's all throughout there, throughout all those codes of ethics, which is an important thing. Here's the similar statement from the AAMFT. And now this is a statement from the APA guidelines, not their code of ethics, but guidelines for the practice of telepsychology. I'm not going to take the time to read that or play that, but if you are a psychologist or senior psych examiner, might not be a bad idea. It's just a little bit different kind of comment than we just heard. The NASW is very specific, and I just want to point out with the cursor here, because this is two slides. This is 12 and 13. So they're talking about all things regarding technology. They have a definition of technology-assisted social work services, and they go on to include everything that includes, including on the next slide. And then they sum it up by saying all of these things like social media, text messaging, email, and emerging digital applications. So they got all their bases covered moving ahead. So I like that kind of wording here. These technology-assisted social work services encompass all aspects of social work practice, all these aspects. And so let's move on. Now we have a sense of how these national professional organizations have addressed technology issues. And why is that important? It's not just important because we have to follow their codes of ethics. It's because licensing boards, when they're trying to develop or needing to adjust, change, whatever licensing rules, one of the places they look to are these national professional organizations. Because if these organizations have already done some of the heavy lifting on a particular topic, whatever, say social media, then these licensing boards may draw from that work that's already been done as they develop actual licensing rules. All right, so let's go to federal laws and technology issues. What's the intersection of those two things? All right, so I'm going to sum this up pretty quickly here. Here are the three major sets of federal laws that mental health clinicians need to be aware of. There are some others that could be, but for the sake of time, we're really going to mention these three. Then we're going to focus on HIPAA. I mean, this isn't a HIPAA training per se, but we definitely will be talking about that. So HIPAA, Health Insurance Portability and Accountability Act, it governs patient and client health care records. HIPAA is all about the privacy of our healthcare information. HIPAA is developed by HHS, U.S. Department of Health and Human Services. So you'll see some of these references that say HHS here in short throughout the presentation. So HHS runs HIPAA, and important to understand, HHS nor the federal government at all has the power, has jurisdiction in states. They don't have jurisdiction about who can practice. Keep that in mind. That is not a federal issue, that is a state issue. The federal government through HHS and HIPAA for covered entities, which most of us probably are, it does develop the laws that we are mandated to follow involving client and patient private information. We'll get more to that in a moment. Now, if you happen to work in a patient-client substance abuse treatment center that receives federal funding, that's an important point. If you work in a facility, a treatment center like that, then your patient's records also have to meet what's required by something called, this is not too catchy, but 42 CFR Part 2. So patient records at alcohol and drug treatment centers, facilities, have to keep their patient records according to HIPAA and 42 CFR Part 2. So there's two layers of it. All right, so let's move to FERPA. What is FERPA? Well, some of you may, if you're viewing this, you may work full-time or part-time in an educational setting. Let's think a university counseling center, okay? Whatever university is close to where you are in this state, they probably have a counseling center. Students go there for counseling. And those records of those students, those counseling records of those students at that educational institution that receives federal funding, just like 42 CFR, if they receive federal funding, then those counseling records are considered educational records and have to be kept according to FERPA, not HIPAA and not 42 CFR Part 2. So you could be let's say you're a professional, an LPC MHSP, you might work full-time at the University Counseling Center. You're providing counseling there. Those records are kept at the University Counseling Center according to FERPA requirements. And later that evening, you may have a part-time private practice, and you may be doing exactly the same kind of therapy, taking the same kinds of progress notes, et cetera, et cetera. But those client records must be kept, if you are a covered entity, in all likelihood you are. Those have to be kept according to HIPAA, not FERPA. It has to do with who owns the records, not the location or the venue where the services are taking place. All right, so let's talk about HIPAA in specific. There's three rules I want to emphasize. You probably heard of these: privacy rule, security rule, the breach notification rule. These set the standards for these areas. The privacy rule, security rule, been around for a long time. The breach notification rule is important for you to be able to access that right away. So what have I done? I've given you links here for all three of these. And note that these links are the primary sources, hhs.gov sites. The reason I mention that is because if you do an internet search for, say, the security rule, you probably would get a couple of pages of law firms that have done their search engine optimization, so they appear on the first couple of pages. Well, it's not that that might not be helpful, but let's go to the primary source, go to the government source to get maybe straighter answers or more complete answers. The government isn't trying to get you to become a client, of course. There's also at this link concise summaries of these rules. I found this and it's a good one. It's empowering learning. And I think it may be, yeah, empowering learning. You can look that up. Here's the link right here. Good summaries there. All right, so a couple of things about HIPAA. Here's some links directly to HHS about HIPAA for professionals. This is the best link to the best web page to start at. If you're a clinician, I assume we all are, then I would really suggest you go there as a first stop and then go from that page to all the other myriad pages that Health and Human Services has regarding HIPAA. So start there. Covered entities, I've mentioned that a couple of times already. Here is a summary of what covered entities are. I'm going to talk about that very specifically in just a minute. Two things I want you to remember. Covered entities in business associates. Here's links for both of them. Covered entities and business associates. And along with business associates, that's a HIPAA term, of course, are business associate agreements, BAA. It's going to be very important here in just a little while. Also, the privacy rule, security rule, HIPAA versus FERPA, links for that. You can click on those if you need to. HIPAA and mental health. Personal representatives. If you work with minors a lot, the HIPAA term for parents and guardians is personal representative. And there's another link here on health information technology. Okay, but let's keep moving. Oh, there's one more, cloud computing, HHS, and authorizations. The word authorization, you should think release of information. That's all that means. It's an authorization is a release of information. It's HIPAA compliant. Here's a link for that. Now, with those sort of go-to sites, let's focus in on covered entities. Under HIPAA, there are three kinds of covered entities. Let me mention this one and this one first. Health plans. No one here is a health plan. No one watching this is a healthcare clearinghouse. However, you are providers. You are a covered entity under HIPAA. If these are just examples. This is not all inclusive. Any kind of a licensed healthcare provider, if that provider transmits information in an electronic form in connection with a transaction for which HHS has adopted a standard. What does that mean? Let me boil it down. What it means is if you're a licensed healthcare provider, that includes LMFT, LPC, MHSP, psychologists, social workers, et cetera. If you have ever one time transmitted any client's protected health information, just think private information about their health care. If you've done that one time, then you have been a covered entity since that moment in time. If you did it once 10 years ago, you've been a covered entity since then. If you did it for the first time last Friday afternoon, then you've been a covered entity since last Friday afternoon. So covered entity, you're almost certainly a covered entity, but there are rare occasions where people are not. If you're in private practice and you have never, ever transmitted any client's protected health information electronically, you're not a covered entity. However, even if you're not technically, I won't go into a long discussion of this, but I would make the argument that you probably should be anyway. You should probably make it internal policy that you're HIPAA compliant. Why? Because everyone else is. And when everyone else in a field is doing something consistently, then that starts to become the standard of care in our communities. And if you're different from that, if you're an outlier from that, it can put you on the licensing board's radar. People can claim that you're not doing things right. You could have civil suits or complaints filed against you with the board, even if you're not, even if you don't technically have to follow HIPAA. You should anyway. Now, here's a recording I'll play about covered entities. And what I've boiled it down to here is for a clinician that's a covered entity, these 5 steps will describe the ongoing process that HIPAA compliance is. Here we go.
A note about HIPAA compliance. A healthcare provider becomes a covered entity, a HIPAA term, if a provider has transmitted any client or patient EPHI, electronic protected health information. All covered entities must be HIPAA compliant. It is important to understand that HIPAA compliance is a process which involves, but is not limited to, the following steps. Step 1, conduct a risk analysis regarding clients or patients' PHI. Step 2, develop methods to mitigate the identified risks. Step 3.
I'm going to stop it for just a second. That word mitigate or mitigation, you're going to hear that for the next hour or so. It's really the key. It's really the key word in my mind about being HIPAA compliant, mitigating risks. Here we go to step 3.
Implement the risk mitigation methods, including new policies and procedures. Step 4, regularly review the effectiveness of the risk mitigation methods. And step 5, identify new risks and change or add risk mitigation methods as needed.
Okay, so it's this ongoing process. It's not that you become HIPAA compliant and then you're done. This is an ongoing cycle process that's constantly running. Now, look in the blue oval up here. I've added this note. HIPAA also applies to business associates who conduct healthcare transactions for covered entities. So we're going to talk more about business associates here pretty soon. Now, before we go any further, I want to spend a few minutes talking about technology and diversity considerations. Diversity, multicultural, that whole realm. I do want to say a few quick but important things about that. Again, I'm not going to read through this, but let me start by just saying things like distance therapy, when it comes to technology, things like distance therapy can help reduce barriers. There are good aspects to technology, even social media and emailing and texting and all those different things. In specific, distance therapy can help clients to access services when they otherwise would not be able to. However, a problem, as stated by these authors here, is certainly accurate. A major problem with the use of technology in counseling is that technology is not equally available or evenly distributed across cultures in the US. And they give some sense that there's some census data here. But basically, it's not a level playing field. If you live, say, in a rural area, and your provider, your clinician offers distance counseling, distance therapy, telepsychology, whatever you choose to call it. Well, if you don't have access to high-speed internet, and even if you have a smartphone, you can't get a signal, then you're left out because you can't access the technology. Or maybe it is available, but it's too costly for you, or there's other barriers to it. Okay, so what are we getting at? Just be aware that as technology evolves, there's a real concern that clients or potential clients with low income, limited accessibility to the internet, especially high-speed internet, may be increasing. These people may be left behind or unable to access services. It can be other kinds of accessibility issues. I would say, someone who is my mom's age, she's passed away now, but my mom, as recently as last year, she would never be able to access technology. She doesn't have the wherewithal to do that. She just can't do it. Couldn't do it. Let's move on. So if you go to NASW's Code of Ethics, here's what the NASW says about these diversity issues. I'm going to play this recording for you.
National professional organizations provide standards in their codes of ethics regarding technology and diversity. For example, the NASW 2017 Code of Ethics states, value, social justice, ethical principle, social workers challenge social injustice. Social workers pursue social change, particularly with and on behalf of vulnerable and oppressed individuals and groups of people. Social workers strive to ensure access to needed information, services, and resources.
All right, so I'll stop it there, but that's what I want to emphasize from this. This is in their preamble. So it's one of the basic foundational values, the NASW for social workers. Now, in the standards, it goes on to say, under cultural awareness and social diversity, social workers who provide electronic social work services should be aware of cultural and socioeconomic differences among clients and how they may use electronic technology. Social workers should assess, keyword there, assess cultural, environmental, economic, mental or physical ability, linguistic, and other issues that may affect the delivery or use of these, that is, technology services. So there's this assessment idea. There's an awareness component to it. There's an assessment, but it's not just for social workers. Some similar things are said here by the ACA Code of Ethics and by the APA, and it's not its Code of Ethics, but its guidelines for the practice of telepsychology. I'm going to skip down here, talking about an assessment. It says such an assessment may include the examination of the potential risks and benefits of providing telepsychology services for the client or patient's particular needs, the multicultural and ethical issues that may rise, and a review of the most appropriate medium, video, teleconference, etc., email, or best options available for the service delivery. So there's this awareness idea. There's an assessment you need to do, and then you do what you can to make the services accessible if they're appropriate in other ways as well. So here's the conclusion. Counseling mental health professionals are generally expected to assess the cultural and diversity factors related to their clients, identify any potential barriers to technology-related services, and strive to minimize the barriers or seek alternate methods for service delivery, which better fit the needs of the patient or client. Important things to keep in mind and have running in the background all the time for us as clinicians. Let's move on to part 4. Websites. Get down to some specific kinds of technology. Websites and provider listing services. These don't always get addressed in presentations about technology and mental health providers. So let me take a couple minutes to talk about this. The reason, or maybe I would say the main reason that it's worth taking a look at is because websites and provider listing services are the way by far that clinicians now make them present themselves to the public. That's how we present ourselves to the public now. Yeah, some of us still have business cards. I doubt there aren't any yellow pages, not printed yellow pages anymore to put an ad in. You may have a sign, like I can see my sign through my window out front of the office. People may see that if they drive by. But by and large, it's websites and it's provider listing services, how people know about us and our services. Therefore, the licensing boards, by the way, whose mission is to protect the public, that's their raison d'etre, right? It's their reason for existing is to protect the public. The licensing boards are very concerned about how we present ourselves to the public. So, and this goes across all different kinds of mental health professions. So in the ACA Code of Ethics, what they emphasize are these fundamental principles of ethical behavior, including fidelity and veracity. Very important when applied, especially to advertising. Here's a statement. When advertising or otherwise representing their services to the public, counselors identify their credentials in an accurate manner that's not false, misleading, deceptive, or fraudulent. And marriage and family therapists, in their standards, 9.1, accurate professional representation through advertising, through the websites, how we make ourselves known to the public. Marriage and family therapists accurately represent their competencies, their education, their training and experience relevant to their practice of marriage family therapy in accordance with, oh, look, applicable law. So that's a point that reminds me to say that not only do codes of ethics address how we present ourselves to the public, using the terms advertising or there's another term I'll think of in a minute about how we communicate things about ourselves to the public. Licensing rules almost always address the same issues in one way or another. So when it comes to advertising / presenting ourselves to the public through technology in particular, this is both an ethical issue and a legal issue. Legal, why? Licensing rules fall under legal. Now, some of this will be a little bit clearer if you have viewed the other presentation, but advertising is an ethical issue as well as a legal issue. Here's what Tennessee, the licensing rules for professional counselors says. I won't take time to read the whole thing. I think it's especially well worded. I'll go to the last sentence. Since advertising by professional counselors is calculated, not spontaneous, reasonable regulation designed to foster compliance with appropriate standards serves the public interest without impeding the flow of useful, meaningful, and relevant information to the public. Basically, all of these licensing rules and codes of ethics, when it addresses advertising and including how we present ourselves on websites and so forth, it's about not falsifying, not deceiving, not confusing, not misleading. That language gets used over and over again. All right, so a couple of self-check questions on this topic. Thinking about your listed credentials, whether it's on your website for your agency or practice or on a provider listing service like Psychology Today's service would just be one example. Are my listed credentials accurate, complete, and current? Well, hopefully. Are the descriptions regarding my training and experience easily understood by the average person? Maybe, hopefully. Do I use acronyms without explaining what they stand for? I'm not picking on anybody here, but just say LCSW. If you walk out on the street where you are this afternoon and talk to 10 people and ask them, can you tell me what an LCSW is? Depending on where you are, my guess is you're not going to get very many people who know what that stands for. So give them more information on your website. Spell it out: licensed clinical social worker. And LMHC does not apply. We just get rid of that because this is Tennessee specific. Here's another one. Are the limits of confidentiality explained? Recommendation: list the limits of confidentiality along with the phone number that potential clients should use to contact you. Okay. Why? Because you want them, wherever they find your phone number, to contact you or your agency, assuming it's on a website or provider listing service. As soon as you can, if they're searching for that information, put it in their field of view, the limits of confidentiality. And then in your outgoing message, well, this is technology too. In your outgoing voicemail message, say you can leave a confidential voicemail. It will stay confidential within the limits as described on the website where you probably got this phone number. Okay, so you're going to give them sort of two chances to realize that it may not be able to be kept confidential, whatever message they leave you. Here's some other things. Are your policies regarding privacy, fees, scheduling easy to find and understand? You don't have to put all your policies on your website, but there's a few key ones like these that I would argue probably should go on your website. Are there clear instructions about how to contact a client to contact you? Does the wording set expectations and so forth? There's some other things we could mention there. So websites and provider listing services, think about it as advertising or some codes of ethics. Use the term public statements. It's the same principle. Don't deceive, mislead, or confuse. All right, practice management systems. All right, these are basically electronic medical records systems that are cloud-based. They're based in the internet. You have to get on the internet to access them. Except practice management systems are electronic records with a lot of other features attached. So many of you, no doubt, will have private practices, and you probably use some of these cloud-based practice management systems. There's a number of them. They're very good and very affordable. So let's talk about it for a minute. This is really at the heart of technology issues for many of us. Here we go. First of all, let me give you a website. This is an excellent resource. There's actually two good ones here. I especially like this one. If you are wanting to do research about these practice management systems, and unless you're maybe a year or two from retirement, if you're in private practice, I really would suggest you take a look at getting a practice management system. There's so many advantages and benefits, and the downsides by comparison are very minimal. Now, here's the website. This capterra.com/mental health software. This will save you hours or days of trouble finding these different practice management systems. It's basically a comparison and shopping and research site specifically at that link for practice management systems. It's probably worth whatever you might have paid for this presentation just to know that link. This other one here, technology advice, also quite good. So now you've got two places to start to research and maybe narrow the list down to 2 or 3 you think would fit your needs. After you do that, you find out any of your colleagues that use those systems and see what kinds of experiences they've had. Capterra does have reviews of these systems by users. Now, one word of caution. Sometimes these practice management system companies will offer you a trial version so you can try it out. It's like test driving a car. But similar to test driving a car, it's not your car. Okay, it's a trial version. Do not put client data on the trial version of one of these systems, because chances are very great that with that trial system, that trial version that you're just looking at and kind of playing with, that there's no business associate agreement in place. And that leaves you vulnerable. Don't actually use trial versions. Use the full version. The trial version is just a test drive. All right, so, but what can these systems do? Many of you are familiar with these, but a lot of you probably aren't. These practice management systems are cloud-based. You have to access them through the internet, but you go through a secure portal. This is all Hipaa compliant, right? That's one of the big advantages. The practice management system company is going to become your business associate, and they're going to have a business associate agreement with you, the covered entity. By doing that, most of the liability shifts to the business associate. That is the provider of the cloud-based practice management system. This takes a huge burden off of us. But let me tell you about the features that you typically get with these systems. I don't get anything out of this. I just want people to know because I think it's a great thing. And the systems are real, most of them now are really good, sophisticated. You get cloud-based remote access at any time. You can wake up at 3 in the morning. Did I write that progress note? You literally can reach over, pick up your smartphone, access your account through the practice management system, and be looking at the client records securely on your smartphone and see, oh no, I didn't write that progress note. I'll have to do that first thing in the morning or whatever. Okay, so now I'm going to say a word about a couple of other things here. Make sure when you access the internet that you have a secure connection. Secure equaling, for our conversation, Hipaa compliant. Basically, don't use open Wi-Fi. You should never use open Wi-Fi for accessing your bank account or anything else that's private or you wouldn't want other people to be able to see. And that certainly includes your accessing your practice management system. Another feature, secure online video counseling platform. If you have one of these systems, you don't have to go out and purchase some other video platform from the many, many companies that are out there. You already have a Hipaa compliant system as just one of the many features of the system. Secure client scheduling and automatic appointment reminder messaging. That feature by itself will probably pay for your subscription, your monthly subscription fee for the practice management system. All Hipaa compliant. electronic insurance claim submission, secure email and or messaging, client accounts and billing, et cetera, et cetera. All this is HIPAA compliant unless you're trying out some recent startup company that really doesn't know what they're doing. You know if it's HIPAA compliant if the practice management system company signs a BAA with you. Don't do it without a BAA, business associate agreement, in place. All right, so all these practice management systems have access to your client's records. You're the covered entity. They are the business associate, as I said before. So before seriously considering a practice management system, providers should inquire with the vendor, the company, about a BAA. If they don't instantly know what you're talking about, start nodding their head and say, yes, 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 you probably ought to go someplace else. This is everyday terminology for them. They should immediately have quick answers for BAAs when you ask about that. All right, let's move on. Here's the bottom line. So we'll play this recording, but this sums it up. But it's one of the more important points today.
How a practice management system can substantially reduce a provider's liability. When a provider subscribes to a practice management system, a business associate agreement, BAA, is signed between the provider, the covered entity, and the practice management system company, the business associate. By becoming a business associate of the provider, most of the liability for security and confidentiality of client records shifts to the practice management system company. This decreases the provider's ethical and legal exposure and in turn frees the provider to focus on other professional activities.
Yeah, so it frees time-wise, energy-wise, it frees the provider up to focus on other clinically related kinds of things. So what are some downsides? There are a few. You have to have access to the internet, so you're dependent on being able to access the cloud, the internet. But you know what? I hesitate to call this a downside because without these systems, then you've got a paper-based system, which means if you wake up in the middle of the night and want to check something, you would have to drive to your office, unlock the front door, turn off the alarm, unlock your internal office door, go in, open your filing cabinet, pull out the file, take a look at it. You would have already looked at it and taken care of it, been fast asleep by the time you even got to your office if you have access, if you have a practice management system. Transition, this is a downside. No doubt some of you watching this have been through a transition from paper-based records to an EMR or practice management system. And that can be stressful. It's like using a smartphone for the first time. It takes some time to get used to it and learn how all the features work for your thinking to get in sync with the technology. So that is a downside. You may be changing from one practice management system to another, from one EMR to another. No doubt some of you have been through that as well. So you'll have a similar period of transition. And the bigger the organization, probably the bigger the headache and hassle. However, again, I'll go back to my smartphone analogy. How many of you who have smartphones could get through a day or two without them professionally? That would be difficult for me. But once you get on the other side of this hump, then things get better and better and better. And you start to really maximize the use of the system and you're less stressed about it. I will emphasize this. The companies that provide these practice management systems are in competition. And one of the things that they are usually eagerly wanting to do is to help you over the transitional hump. So unlike perhaps other experiences you or we may have had with customer services, these companies are typically very motivated to help you get over the hump because they know once you've done that, you'll stay with them, and they have a subscriber for years and years. So don't discount that. Sometimes they will volunteer to do things for you to help you along, especially important for independent solo providers in private practice. Cyber attacks. This has actually happened back in June of 2017, I'm just going to play a little bit of this recording. This is an open letter from a company called Therapy Notes. Yes, Therapy Notes is a name of one of the practice management system companies that's out there. They seem to have a good product, but they got affected by this. Listen to this.
Early morning, June 26, 2017, our IT team detected a ransomware virus on our network. Files were becoming encrypted and therefore inaccessible. We quickly shut down all servers to minimize the impact of the virus and so that we could assess the situation carefully. Our forensic review determined that a server was most likely compromised by a vulnerability in Windows. An update for this vulnerability was released only days earlier by Microsoft that unfortunately was not yet installed on this particular server. Once that server was compromised, a variant of the SamSam ransomware virus began running on it and began encrypting files on all other servers, making them inaccessible to us.
All right, so here you have a practice management system company. All their subscribers on June 26, 2017, if they try to access their practice management system, say look at client records, look at scheduling or any of that, they couldn't do it because hackers had gone in and they had encrypted the data. They locked it up and held it for, literally held it for ransom. They didn't delete it, they didn't destroy it, they locked it up. And they say, I've got the key. If you want the key to unlock your data, you got to pay us. Now, they didn't pay them, but this was a worldwide ransomware attack. It wasn't focused on Therapy Notes. It was just unfortunate bad luck that they were involved. So it's not anything negative to say about them, I don't think at all. So it can happen. It's rare, but you know what? Other kinds of disasters can happen to paper records. How many of you know of someone whose records there was an over the weekend pipe burst in a ceiling and drenched all the records for 48 hours, or there was a fire, or there's things can happen. So I want you to make aware there are some potential downsides, but all in all, to me, it's really good news that these practice management systems are at the point where they are. They can do so much for your practice or organization, make things so much more efficient, and limit your liability at the same time. That's just huge. Oh, so before I say any more, most of these top tier, best practice management systems, the prices are incredibly affordable. $60 a month for a solo practice in that neighborhood. $60. Yeah. So they want you as a customer and they want you to stick as a customer long term. All right. Social media. All right, let's talk about social media. First step here. This is I played this recording earlier, but sometimes I wait till this point to play it. Remember, this is what the ACA said about technology and social media and distance counseling. It's this whole concern about being aware of technology, how it works, making sure you protect confidentiality and meet legal requirements of such. All right, so these are some things I think of as advanced practice resources because it seems like not many people really know about these. Let me start by saying this. Licensing boards, or in some cases they're called regulatory boards. Every state in the U.S. territories, Washington, D.C., and also the provinces in Canada. All these licensing or regulatory boards for mental health providers like we are, they have their own associations of which they are members. They themselves, members of these boards, are the ones who run the association. The boards themselves from the states or territories or provinces are actually the members of the association, but the same individuals are involved. So it happens to be that, let's see, from the Association of State and Provincial Psychology Boards, they have two terrific resources available on their websites. Here are the links. The first one are guidelines for the use of social media. So now, even if you're not a psychologist, if you're a social worker, marriage family therapy, this is still a great resource. And that's one thing I want to convey. I would encourage you to think outside your own profession in terms of educating yourself about writing policies, making policy decisions, making important decisions. Yes, the code of ethics and licensing rules that specifically apply to each one of us are there. But these other codes of ethics, these other associations like these associations of licensing boards have great information that's very relevant, even though it's not specific to our profession. This is the case here. The same organization, the Association of State Provincial Psychology Boards, also has a white paper on guidelines for the use of social media. Here are the links. Take a look. It'll give you lots of good ideas. And this one, in fact, has a sample social media policy that you can look at and develop your own by looking at that. I've got one. I've included these materials. So when we're done, you'll have access to not one, but two social media and communication policies. Put this at the top of your priority list, I would suggest. If you don't currently have a communication and social media policy for your organization or practice, put it number one priority. It's not a would be nice kind of thing. In my mind, it's absolutely necessary to have that in this day and age. All right, so great resources there. Social media and multiple relationships. So the overriding concern, especially ethically, from an ethical perspective, with social media is the potential for blurred, confused boundaries and potentially multiple relationships, that kind of thing. So let me start with the ACA Code of Ethics and see what it says. These are all quotes here from the Code of Ethics. Personal virtual relationships with current clients. Counselors are prohibited from engaging in a personal virtual relationship with individuals with whom they have a current counseling relationship, for example, through social and other media. There you go. If you're an LPCMHSP in Tennessee, you have to follow this. You cannot ethically have a social media relationship with a current client. It's not ethical according to this standard in your Code of Ethics. Slightly different. The NASW Code of Ethics. I'll skip down here. Well, no, I think I'm gonna play this. This has a lot of good information in it. So hold on and we'll listen to this.
Social workers should be aware that posting personal information on professional websites or other media might cause boundary confusion, inappropriate dual relationships, or harm to clients. Social workers should be aware that personal affiliations may increase the likelihood that clients may discover the social worker's presence on websites, social media, and other forms of technology. Social workers should avoid accepting requests from or engaging in personal relationships with clients on social networking sites or other electronic media to prevent boundary confusion, inappropriate dual relationships, or harm to clients.
So the NASW doesn't prohibit it like the ACA does, but says social workers should avoid doing this. They share the same concerns, don't they? Sure they do. All right, so here's some action points for social media. We could, another time we could take a deeper dive in this, but here are, to me, these are the action points in just my suggestions regarding policies and procedures. To give you something to think about. Number one, establish a social media and communication policy. Now, I've actually got that here. It starts 2 slides down from this. We're not quite there yet. And it says the resource section. That's not really accurate. Don't worry about that. So in the social media and communication policy, cite the applicable code of ethics and or licensing rules in your policy. So in your social media and communication policy, point to the relevant code of ethics and licensing rules. You might even want to quote parts of that in your policy to communicate to your clients or would-be clients. I have to follow these. I have to follow these ethical standards and to follow my licensing rules. That's why I have this policy. Post the social media policy on your website so people can access it 24/7. Would-be clients or past clients who've forgotten what the policy is. Updated annually. Social media, it's the ACA Code of Ethics here. Social media is part of informed consent. Counselors clearly explain to their clients, as part of the informed consent procedure, the benefits, limitations, and boundaries of the use of social media. But remember, you can't have a social media relationship with them. You might have a presence on social media professionally. I do. I don't take friend requests, except from other professionals. That's what it's there for. And I state that on that particular page. So it's not that you can't have a professional presence in social media. It says you should avoid or are prohibited in most cases from having those specific relationships with current clients. And to me, it makes sense to extend that to past clients too. But that's just my opinion. All right, so the social media policy, communication policy, provides a lot of different benefits. Let me pick out a couple of here. Here, it sets important boundaries about both clients and therapists' presence on social media. As I said before, it cites key portions of licensing rules and codes of ethics. You should post it on your website and so forth. But let's take a look at this example. I'm not going to read through this. This is for you to look at as time allows. Now, this is just for an illustration. This is not intended to be legal advice. It's not intended to be a template for you to use. You can pull from it if you like to come up with your own social media policy. So it's going to talk about things like friending and similar. You're going to address that. And look, what I say here, now this isn't me because I'm not a professional counselor, but this wording, I follow the code of ethics of the ACA, and it says this. Right at the outset, I'm setting that boundary and where that boundary comes from. Here's where I mentioned I maintain a professional presence for my practice, in this case on Facebook. This presence exists solely to provide information, et cetera. It's not for you to send me a friend request. I won't respond to this. The second half of the social media policy gets into communication through instant messaging, emailing, texting, phone calls. Now, I've included the electronic journal because some practice management systems, the one I use does, has an electronic online secure private journaling feature that's available to clients. So they can access the practice management system on the internet, go through the secure portal, very similar to accessing your bank account online. You got to have a password. You got to have a user ID. You've got to have several security questions, that kind of thing. They go through that process. They can access your system, and they can access an electronic journal, which they can set for, in my case, they can set it where I can read it or not read it, but it's online, so they can add to it anytime they have access to the internet. So you want to have written policies about communication. And this is where we as providers have to have good boundaries about it ourselves. Number two, the second action point, keep your professional social media presence separate from your personal social media presence. For example, the ACA code says this: counselors who wish to have a professional presence and personal presence for social media use, separate professional and personal web pages and profiles are created to clearly distinguish between the two kinds of virtual presence. Why? To avoid confusion, blurred boundaries, multiple relationships, etc. If you have an organization, make an internal policy about this for everyone who works at your organization. Policies aren't just for clients. Sometimes they have internal functions as well. Oh, by the way, I'll tell you a quick story about this. A few years ago, I was at a musical venue here in Nashville, and I knew one of the performers. He was the son of an old friend of mine from grad school. So it was a great performance. And at one point, I picked up my cell phone and said, I'm going to take a photo of him and post it on my personal social media account where my old friend, the performer's father, will see it. He'll love seeing a picture of his son performing and knowing that we were enjoying it. So I did that. And then I don't know, maybe 20 minutes later, there was a break in the music between sets, and I hear / feel that familiar vert, 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 vert. It's a text message notification. Okay, well, I had time, so I looked at it. It's from my old best friend, Matt. Matt, at the time he's retired now. He was a information technology, chief information technology officer for a large healthcare company based in Nashville. He had sent me a text that said, he typed out HMMM ellipsis, Renaissance really gets around. Well, Renaissance was a reference to the name of my practice. What he was telling me in his own sort of poking way was to say, hey, you posted a personal photo on your professional social media account. That was no big deal. I took it down. But it's so easy. Technology wants to make things easy for us, but by doing that, it constricts the boundaries of time. It eliminates pause buttons so that you can do things immediately. And that's one of the dangers. Built in by habit and or policy, delays in time. Good example. How many of you have gotten, say, an email from someone who is upset about something and they're directing it toward you? And how many of us immediately sit down and type out a response and send it? Probably not a good idea. It's probably better to sleep on that and look at it the next day. So we have to build in the buffer zones, and technology sort of fights against that in many, many ways. Keep your social and professional presence separate. The third one under social media action point, respect the privacy of clients' social media presence. Don't creep on your clients' social media. The ACA says counselors respect the privacy of their clients on social media unless given consent to view such information. Here's my suggestion over here. Do not access a client's social media, even if the client has given you permission to do so. It's what I call the law of unforeseen consequences comes into play here. It has potential for changing things and for you learning things from their social media that now present a dilemma or a problem or confusion. So what do I suggest? Normally we obtain clinically necessary information regarding clients from these proscribed sources, intake forms, interviews, client self-stated history, direct observation, testing, et cetera. Once you start getting information from some other place, like their own personal social media, it changes things. So it creates problems potentially. Here are some self-check questions about this. How might my client feel, or what might my client think, if she or he discovered that I had been looking at their social media? They might be okay with it, they might not. How would you feel? How would I feel if I discovered that my client had been looking at my social media? Well, it depends, but I don't particularly like it. If I learn something about my client from their social media account that conflicts with what they're telling me in sessions, where's that going to lead? That creates a dilemma and a problem. Which information is accurate? Why are they telling me things that are in contrast, that contradict what they're saying online? How about this one? Would I be able to reliably remember the source of specific information about my client? What I mean is, if I know something, I'm remembering something about my client, did they tell me about it, or did I read it at midnight last Saturday when I was creeping around on their social media? Maybe your memory is better than that than mine. You can keep that separate. That's something I think could be risky. How about this one? Would it be appropriate or ethical to go to the street, public street, outside a client's residence and spend time observing the activities going on there? It's not illegal. Is it unethical? Well, most of us are going to say, yeah, that's a boundary issue there. Is this any different than going on a client's social media? Something to think about. You might agree with that, you might not. All right. Supplemental resources. This slide has a list of some resources that I have chosen to put in here for you to go to. Covers a lot of different topics regarding social media. And here's some more of these at the end. This is on slide 55. All right, so we're going to go to email and texting, keeping an eye on the time here. I'll go through this pretty quickly. And then we're going to get to interjurisdictional practice briefly, distance therapy. We don't have time to go into distance therapy in depth. That was determined from the beginning with this presentation. Email. The overriding question about email is, can you use unencrypted regular email like Gmail? Well, it depends. So let's take a look at this. Email and texting could be used to transmit clients' private information. But remember that HIPAA and the other federal laws apply to the electronic transmission of a client's protected health information. Well, this is going to directly involve that. Under HIPAA, it's the covered entity's responsibility to assess risks, take appropriate steps to mitigate the risks, and then you need to document what you've done. So keep that in mind. There are vendors, there are companies that you can purchase secure mail applications from. Here's some information about that, if that fits your needs better. But here's what I want to get to. The HIPAA security rule requires that we mitigate the risks. It doesn't expressly prohibit the use of email for sending EPHI, but we have to follow this. The HHS Omnibus Rule states that if clients are notified of the risks of unencrypted email and still prefer unencrypted email, the individual has a right to receive protected information in this way. And covered entities are not responsible for unauthorized access of PHI while in transmission to the client based on the client's request. Further, covered entities are not responsible for safeguarding information once it's been delivered via email. So you say, well, I can use regular email. I would highly recommend against it. Why? Because it's on us to mitigate the risks. And how many times have you heard clients say, well, I didn't remember that rule or that policy or that this was a risk. Yeah, so I would avoid doing it. How do you do that? First of all, the easiest way is to simply use HIPAA compliant, that is secure, encrypted email. If you have a practice management system, it's built into the system already, okay? So you want to avoid doing that for a variety of reasons. Here's some ways to mitigate the risks with email. For example, so these are policies you can implement. You have a policy that ensures clients understand the risks and you get their signature to document it. You limit the amount or type of information disclosed to issues such as scheduling of appointments. Let me stop for a second. How many of you get reminders from your healthcare provider, your dentist, and so forth that come through text or email? How can they do that? They have hired a company, a vendor, who knows how to sufficiently mitigate the risks according to the HIPAA security rule. That's how they do that. And they employ some of these methods here. That's why, if you recall, if you reply to one of those appointment reminders, you push 1 or type in the letter Y, and that's it. That's it. It's that you can't really send anything else. That's one of the ways they mitigate the risk. Never include sensitive information in an unencrypted email. Don't reply. Don't hit the reply button to a client's unencrypted email, because by doing so, you could be sending the entire past thread conversation, not only things you said, but things they said. You're now transmitting that. So don't reply. Create a brand new email that answers the question that they had. You might establish a code word. This can be a good thing to have, especially with certain populations. For instance, domestic violence would be a good example. Texting, real quick here, texting, similar to email, HIPAA doesn't really address it directly. The mitigating of the risks still applies. Here's some downsides to texting. They're self-evident. Clients' expectations. Most people expect quicker responses. That changes the relationship potentially when they have this sort of instant access to us and their clients. Confidentiality and security. If I set my phone down somewhere, somebody could pick it up and text a message. So how do you know you're getting a text message or an encrypted email for that matter from your client? Well, you need a way to determine that it's really them. Potential for confusion. This is the biggest one. Emojis, abbreviations, acronyms, shortcuts, not to mention autocorrection problems, voice to text and voice command. All this makes texting less than ideal to communicate formal communication between a healthcare provider and a client or a patient. It's fraught with things, dangers that you are going to have to be mitigating and that you can demonstrate that you have mitigated. So in general, avoid texting with clients. If you do, you got to have a specifically addressed in a communication policy with limits on it. By the way, have both an internal and external policy about texting. Be Hipaa compliant. Assess the risk to your clients texting, develop methods for mitigating the risk. Here's some ways of doing that I've already mentioned. So it boils down to this about emailing and texting. There are two options basically. Option one, the emails and texts are encrypted and or otherwise secure, that is to be Hipaa compliant. And this is probably the best, easiest option for most of us. Option two, the covered entity, us, warns the patient that the communication is not secure, and then you do this. You take steps and more steps and probably some more steps. So have a client sign over this green box here, have the client or patient sign a document to this effect. I wouldn't do it. I think it's easy to get encrypted email these days. It's not hard to use, especially if you have a practice management system. Here's the link for this information up here. It's a good link. It'll explain it further. All right, now interjurisdictional practice. We're not addressing distance therapy here in any depth. So I want to give you just some nuggets, some things I think will at least be helpful. Here's what I'm saying about that here. This table, I put this table together, as it says here, to summarize the circumstances for legally practicing across state lines. So hang with me for a second. I'm going to start here where it says general. This won't be sufficient, but it is something you can look to kind of get the options or the problems organized in your mind. The originating state, that's where you are physically when you provide the services. The originating state jurisdiction, that is the physical location of the provider when the services are being rendered, and the destination state jurisdiction, that's the physical location of the client when the services are being rendered. So originating jurisdiction, destination jurisdiction. If it's interjurisdictional practice, then there's two different jurisdictions involved. So the destination state must have a legal provision of some type that authorizes the provider, presumably in the state where they're licensed, that authorizes the provider to render services to someone who's in that other state. It's all about physical location. It's all about physical location. So the best scenario is that the provider is licensed in both states. Everything's good. Here's the second possibility. The state in which the provider is not licensed, whether that's the originating state or the destination state, it could be either one, depends on where the provider is, right? But the state in which the provider is not licensed has a statute that allows temporary practice by a provider who's acceptably licensed in the state where they're not licensed. A lot of states have some sort of statute allowing temporary limited services by someone who's licensed in another state, meaning that they can provide services to someone in the other state on a limited basis. But the statutes vary significantly, and it greatly depends upon the state in question. Executive order, during COVID, this applies. The state in which the provider is not licensed has an executive order which temporarily allows practice in the other state. Here's the coming thing: Interstate Compacts. PsyPact for psychologists is up and running in 27 states. Counseling Compact is coming along later. These are agreements among states who are members of the compact. It's sort of like a treaty where they make mutual formal agreements allowing you, if you are licensed in one of these interstate compact states, to provide services to or from the other compact member states. So that boils it down right there. Here's a great resource, the Telemental Health Laws app. Here's the link for it. It is a free smartphone app that will tell you up to date what are the statutes, if there are any, in the 50 states and DC and Puerto Rico, if any of those jurisdictions have statutes allowing you to practice to or from their state. It's a free app. It's free. Get it today. State executive orders. Here is a link where you can look up state executive order. These are by nature temporary regarding inter-jurisdictional practice. So hopefully in a few months, we won't need to be looking at such things, but that's the link for that. Here's a little blurb about the interstate compacts. I already said this. PsyPact's up and running. They've really taken the lead. The psychologist folks have. Counseling is behind. Social workers, it's in the works. Marriage and family therapy does not have any compact that has been started. There's no mention of it on the AAMFT website or any of the other sources I can find, like their Association of Licensing Boards website. There's nothing there about it, unless it was put on there very recently. Now, what we've got here, we've used up an hour and 15 minutes, but I wanted to show you there are several vignettes here. This can be great for discussion with your colleagues about technology and ethical and legal issues. So take a look at these. It really is interesting to do in a small group setting. I used to do these for our staff meetings once a quarter. Very effective. Here are some strategies that you can look at, or I might address some of these in the few minutes we have left. But I've got a few slides of strategies for avoiding technology-related ethical and legal problems. But see, Janine, you're probably listening here. I know that we're close to an hour and 20 minutes in. That gives us about 10 minutes or so for Q&A. Do you have any questions you want to ask?
Hi, Terry. First of all, thank you so much for doing this. It's just chock full of information, which
Yeah, I know.
you know, I don't have to tell you that.
Much. I know.
Well, it's very, very useful information. And I know the slides will be available somehow. I'm sure Ben will get that information to everyone.
Good.
And I think these strategies would be great for us to kind of jump into now. I think you presented the information clearly. So
Okay.
if you want to just
happy
jump
to do
in there. Yeah, let's do that.
If you will give me a verbal heads up when we're down to our last minute or two.
I can do that. And Amanda probably may jump in as well.
Okay, that's fine. That's fine. So I've got us about an hour and 21 minutes in, something like that. All right. Okay. So strategies. This is just an assortment of recommendations or suggestions or things to keep in mind that are relevant to technology, ethical, and legal problems, as it says here. Let's take a look. Top of the list, implement an effective social media and communication policy. Remember, I gave you an example in these materials, but remember, you can also go to the Psychology Licensing Board Association's website. You have the link in the materials, and they have guidelines for social media, and they also have a white paper. I think it's the white paper that contains an example of a social media and communication policy. So no excuses, right? It's sort of being handed to you. Make that a priority. Boundaries, right? Boundaries. There are technology boundaries, obviously. And this is a different game, sort of. This is a different kind of world, especially if you work with minors. Right. So, you know, I would say consider attending a state-specific ethics and minors training. To be honest, I don't know of anyone else but me that does that. If you want to contact me, I'll tell you how it's available. But these boundaries, and there's a lot of state statutes regarding minors that are all over the place. The range, let me give an example, the range of ages at which a minor may consent for their outpatient mental health treatment goes from as low as 12 in some cases up through 17.
Right.
So some states require you be 18. Some states as young as 12 under certain conditions, you can consent to your own treatment. And it's not just those laws. Laws about minors' rights, and parents' rights vary considerably. Distance therapy technology changed rapidly. It's pretty obvious. I kind of like the idea of devoting one afternoon a month to developing maintenance of policies, especially as pertaining to technology, because things change so quick. Be proactive about networking. It's always a good thing. Get good ideas, resources about legal and ethical developments. All right, I said this before, so I won't spend much time on it. Don't use open Wi-Fi if you're accessing anything that's private. Bank account, maybe your investment accounts, your practice management system, certainly. So what I suggest is this. First of all, you can use secure Wi-Fi. That's okay. Secondly, you can use your smartphone's hotspot function. If you're not familiar with that, if you got a smartphone, it will broadcast in a radius of a few yards a secure Wi-Fi signal. And you can tap into that with your laptop or tablet and be on the internet in a secure fashion using your cell phone's hotspot. The best thing, and one would be a great second step, would be to get a VPN, a virtual private network. You can have this installed. It's an app that gets installed on your device, and it makes all your data go through, if you can envision an encrypted tunnel. People can't track you, they can't hack into it. It's very secure and more than HIPAA compliant. All right, be a member in a state professional organization. Why am I saying that? Here's why, because these organizations probably have their ear to the ground about developing licensing rules or other kinds of changes that might affect you in your practice. So we can't be attentive to all those things all the time ourselves. Be a member of a state and probably national professional organization, and they will send you this information, or at least have it on their website. Continuing ed, if your licensing rules require you to get 3 hours of continuing education in ethics or state laws, from my perspective, that's not near enough. That's not near enough. These things change all the time, and we have to know about them. Saying, well, Your Honor, I didn't realize that changed a year and a half ago, or the licensing board. I'm sorry, I wasn't keeping up with that. I'm too busy. That is not going to fly, right? Okay. Okay. Look for technology-related education and risk management resources available, get this, through your professional liability insurance company's website. Yeah, they don't want you to have a lawsuit. They would like to prevent that. Some of these companies, not only can you get continuing ed hours by going through these trainings, they will give you a discount on your premium. So go online, check your professional liability insurance company, their website. Invest in advanced training specific in technology issues. I just gave you a couple of sources here. There are lots of sources. Make sure it's a reputable source, of course. Make sure you have current BAAs with all your technology related vendors, your distance therapy vendor, your practice management software company, etc. That's not, I don't have it handy. I could show you several examples of the fines that were levied through HHS It's actually the Office of Civil Rights, which operates out of HHS. $10,000, $80,000, depending on the circumstances, have BAAs. Avoid use of unencrypted texting and email. I said that already, of course. Psychotherapy notes. Psychotherapy notes has been my experience that it's like a great tool you have in the bottom of your toolbox. And you don't think about it being there. And when you do finally see it and realize what a great tool it is, you say, well, I could have used that last week. I could have used that yesterday. It's a great tool. Let me summarize. Psychotherapy notes, that's a specific HIPAA term, psychotherapy notes. They're not called anything else. They're only called psychotherapy notes. A better name, if they had asked me, would have been psychotherapist's notes, possessive, because that's what they are. They're a psychotherapist's private notes about a client. They're not part of the clinical record. By definition, they're not. They're not accessible by your clients unless they come with an actual court order, not a subpoena, a court order. The judge is saying you will turn these over. Okay, then of course you're going to turn them over. So make use of psychotherapy notes. That's not directly a technology related thing, but almost always put it in the suggestions at the end of a presentation. So two important other tools pertaining to interjurisdictional practice. I mentioned these briefly. It's that Telemental Health Laws app. Here it is. You can get it in a few minutes. It's free. And a listing of state executive orders. Very relevant at this point in time. Here's the link for that right there. Look those up. If you're doing distance therapy, those are probably the two most valuable resources you're going to have, and probably worth the price of admission to today's show. So, okay, so I'm at the end of those. Janine, what else are you thinking, or any other questions?
Well, it looks like we just have a minute or so left.
Let me give two websites real quick.
Yeah.
PsyPact. If you're a psychologist,
yes,
go to psypact.org. PSYPACT.org. And that website is great. It'll explain all about how PsyPact works. Tennessee's in it.
Right.
Okay. So,
right.
And you can apply to either provide services to another PsyPact state or from another PsyPact state. It'll explain it. CounselingCompact.org is the one for professional counselors. CounselingCompact.org. Okay.
Great. Well, I believe we should probably wrap it up at this point.
Okay.
Thank you again, sincerely,
sure.
for
I'm glad it worked out.